Hello and welcome. My name is Sarah Russell and I'm a clinical exercise specialist, cancer rehab specialist and clinical Pilates teacher. I'm also the global exercise consultant for Convatec, exercise specialist for the IA, as well as author of the Bowel Cancer Recovery Toolkit. I'm the founder of the Ostomy Studio, where I teach online Pilates and exercise classes to people with stomas, and I've lived with a stoma myself since 2010. And thank you for having me here today to speak. So over the last few years, we have seen a huge increase in awareness about the importance of abdominal exercises after stoma surgery, and this is fantastic. Instead of telling patients to rest and avoid exercise, we need to rehabilitate that healing abdominal wall and fascia through super gentle core exercises. Patients benefit from feeling stronger, less vulnerable, able to return to their daily activities sooner, and it's likely we'll be reducing the risk of parastomal hernia in the long run. However, I want to share with you what I'm seeing in my rehab practice with patients and also with nurses and physios, both through my private work and also through the HALT trial. I'll address some of the problems I'm seeing and share some of my more current thinking on core exercises. So in this presentation, I want to talk about the importance of the diaphragm and breathing. I will teach you a simple breathing technique, which I now believe should actually become before people start to do their core exercises. This is super simple for you to teach to patients and simple for patients to learn, and it forms the foundation of core rehab before they progress into their exercises. It's actually the fundamental principles of clinical Pilates, and when we get this breathing technique right, it means that the core and abdominal muscles are working properly. We have full engagement of the core muscles and better rib and pelvis positioning. So let's start with basic anatomy of what we call the inner core. We need to think of the core as an integrated structure. Nothing is separate. We can't isolate anything. So deep inside the body, we have the diaphragm, the pelvic floor, and those deep abdominal muscles called the transverse abdominis. All of these muscles work together as an integrated unit, and we refer to this as the inner core. The diaphragm itself is a dome-shaped muscular tendinous structure that's very thin, around 2 to 4 millimeters. It's concave on its lower side and it separates the chest from the abdomen. It's attached to the ribs, the sternum and the vertebra, and there are connective links between the diaphragm, the pelvic floor and the deep abdominal muscles. When we have a problem with the diaphragm or any of the structures related to the connected fascia, this results in dysfunction throughout the whole body. We also need to think about the pelvic floor as being a second diaphragm, and it rises and falls in conjunction with the respiratory diaphragm. So after surgery, the function of the core can become disrupted. People forget to breathe properly, they start to breathe into their upper chest, and you've probably seen that in your own patients. If we don't retrain the correct breathing pattern and diaphragm action at the beginning, it sets people up for dysfunction. And good function is important because we need this in order to manage and control intra-abdominal pressure. And of course, managing intra-abdominal pressure is key in reducing the risk of parastomal hernia. Almost every single person I work with that has a hernia also has a dysfunctional breathing pattern. And this is just an anecdotal finding that I've noticed. But they're not activating their deep core correctly. They're not breathing properly using the diaphragm, and they can't control their ribs. You see them breathing into the upper part of the chest, and they've got a bit of rib flare. Their ribs are sort of jutting out, and this places almost constant pressure on the anterior abdominal wall. And that's the last thing we want. We need to offload the anterior abdominal wall as much as possible. So the very first thing that everyone needs to do before they start on their core exercise program is learn how to breathe correctly using the diaphragm. Breathing training has loads of other benefits, including stress management, lowering blood pressure, but in this context, we're going to focus on the muscular and fascial connections and just simple retraining of function. So this is an intentional breathing exercise that people can learn before stoma surgery or at any point afterwards. It teaches people how to engage the diaphragm, the deep inner core, and it pulls together the function of the pelvic floor and all those abdominal muscles. And it teaches people how to position their ribs correctly over their pelvis. And when that happens, their abdominal muscles are working correctly. We offload the pressure on the anterior abdominal wall and pelvic floor and reduce the risk of hernia. And actually, we're reducing pressure on any existing hernia as well. So how do we do it? So first of all, let's just start by sitting and relaxing and breathing normally. And you might even want to close your eyes. Sit and place one hand on your chest and kind of one hand on your belly. Just completely relax and just breathe normally. So I want you to become aware of where your breath is going. Is your breath going into your ribs? Is your breath going into your belly? Is it coming into your shoulders? Are your shoulders rising? So let's just start by becoming aware of that, where you breathe and what your patterns look like. So we want to think about sending the breath into the ribs so it becomes a lateral breath and we start to activate this diaphragm. So instead of sending the breath too far up into the chest with shoulder rises, we want to think about taking those ribs nice and wide. So it can be really helpful to think about this is like umbrella breathing. So use that as a cue with your patient. So we're thinking about opening the ribs like an umbrella, pulling the ribs back down together. So we're going to start. We can practice this in sitting, in standing, or in lying. So people can do it in bed. You can try it on the floor. And I'd encourage you to try it in different positions to see how it feels. So we're going to start just in a seated position, just here in front of the camera. You're going to place your hands around your ribs. So think about sending the ribs wide and opening up like an umbrella. So breathe in through the nose. And you can see my hands go wide, and then exhale and pull back down. And again, breathing in. And send those ribs wide, and then exhale and back down. And again, send those ribs wide. Inhale. And exhale. Now exhale fully, all the way, fully empty your lungs, and feel that you can start to connect the deep abdominal muscles. You might even feel like you can pull that pelvic floor up. So we inhale again, one more time. Exhale, feel those ribs pull back down together. Exhale all the way out and start to bring in a little bit of a wraparound feeling of those deep abdominals. And you'll feel like you're starting to stack the ribs above the pelvis. So you're starting to kind of pull everything down and stack, so you're reducing any rib flare. So think about an umbrella. We open up on the inhale, we exhale and pull those ribs back down together and start to connect those wraparound deep abdominal muscles. You might even feel like you can start to bring the pelvic floor up a little bit inside. So this is the key starting point for everybody. And this can be done before surgery, after surgery, if people have got hernias at any point before they start to do their core exercises. Get this right first. People will benefit more from their core exercises. So remember, this isn't a new way to breathe. This is an intentional exercise. So we want to encourage people to do this maybe for a minute or two at a time. Then they take a rest, but they can repeat it a number of times throughout the day. And then they start to integrate this into their core exercise practice. So that breathing and that exhale becomes a really important part of doing their abdominal exercises. So you can access all of this information through the new Get Ready leaflet produced through Convatec. And this kind of comes before the Me Plus Recovery program. So we really want to get this right with patients first, because we're talking about offloading the anterior abdominal wall, reducing intra-abdominal pressure, and patients will get a lot more from their exercises if they get this right first. It's also much easier for you to teach. So if you do nothing else, just teach them this rib breathing exercise. So thank you for listening. Thank you for being part of this. You can access this information on the Convatec virtual booth, but please don't hesitate to reach out to me if you need any help. And thank you for watching.